All right, good afternoon, everyone, and thank you very much for inviting me to talk about my work in the NWT. Today's talk is based on a selection of my studies that have informed my research at ARI. I will focus on women's health. I've built a research program around the health of women across the lifespan, from newborns to the elderly. I have viewed the world from a gendered lens. Since I was a child, actually, I was one of 6 girls born to Gus Tracy and Clara McCartney in a little rural community in southwestern New Brunswick. To begin, I would like to acknowledge that I'm honored to be sharing this talk with you from Chief Dragi's territory and land of the Yellowknife Dene First Nations people. I would like to thank all Indigenous people for the privilege of working and learning on your land for this some 30 years. The strength, beauty, and creativity of the Northern Lights is what I know to be demonstrated by Northern women who have shared their stories with me about determinants of their life. In 2012, in a chapter I wrote from a text entitled Rural Women's Health, I stated, the health of pregnant women and their unborn babies is pivotal to community vitality and the health of future societies. I believe that today as well. I'm only briefly going to situate us in some demographics, but I would like to refer you to the NWT Health Status Chart book that has been prepared by the territorial epidemiologist and which provides a very good look at the population health of women. So in 2020, a population here in the territory was 45,161. And of that number, women accounted for 21,930 persons. So we do have more men than women. Another important feature, given my age, is that people over 60 years total 6,594 persons, and they are the largest growing group in the territory. And another very large group are the 25 to 44 years old women, and there are 14,146. We do know that the birth rate is decreasing in the territory, and in 2019, it was at 581. So I do want to say right here that I will be talking about NWT women as victims of interpersonal violence. And in this document from the Department of Health and Social Services, they raised the statistic that violence, women experiencing this violence, is 10 times the national rate. This makes this issue one that's very important for us to discuss, but I just want to give people who are listening a little heads up because it may trigger you with some of the talk of violence. So just get your guard up a little. So this slide looks rather busy, but I wanted to share a little bit about what I've been up to while I've been in the territory. So women's health, if we were looking for a definition of it, is the effect of gender on disease and health that encompasses a broad range of biological and psychosocial issues. I only have a short time to talk today, but I wanted to include here some of the research practices, activism, health promotion, and interventions that I've conducted over the past few years of being in the territory. Mostly the last 10 is what I will talk about, but you will see in this slide where I've been. So in terms of infants, I have been conducting infant feeding studies. I'm currently doing a study with a CIHR grant on maternal health care systems and infant as sacred spirit. We have been involved with Baby Friendly Initiative in the nursing curriculum. And with children over the years, I had the good fortune to be involved in some knowledge translation and health promotion. And some of you may remember this. I wrote in the early 90s, I developed a little coloring book called Clara's Choice, and it was in the hospital a lot. And also at the college, we were involved in Teddy Bear Hospital, and it was a very health promotive venture with children to overcome their fears of being hospitalized or visiting a clinic. With both young adults and children, I've been involved in violence studies. And, you know, I could add even a few more to this list, but they range from intimate partner violence, emergency protection orders, the Canadian Domestic Homicide Prevention for Vulnerable Populations Initiative, which is a SHRC grant that we are now just finishing up. And there will be an online conference in May that some people may like to attend. Also, I'm on the expert panel with the Canadian Femicide Observatory for Accountability and Social Justice. And I would encourage people to visit this website. It's full of information and it's relevant for us as Northerners. As well, I was a witness at the Murdered and Missing Indigenous Women and Girls, the hearing that was held in St. John's, Newfoundland. I've been involved in rural and remote nursing studies, a national study in health careers in the NWT, in a project that we did with students called Healthy Steps with Western University. And we are currently working on a history of the School of Nursing here in the North. So any of you former graduates out there will be contacting you at some time. And in older adults, Brianne Timpson and myself did a study on the influences on quality of life with older adults here in the North. And I will share a little bit of that today. And as well, I have the good fortune to work internationally with some Norwegian and Sami colleagues in Northern Norway on a project with older adults called Sami Caring. I just have to have a drink of water, guys. So this slide is to take me back to my master's study and my doctoral research that furthered my interest in women's health. And I felt it important that I share this today. Back in the late 1990s, I began to investigate the integration of culture into our nursing program. And I wrote about this in a paper published in the Canadian Journal of Nursing Research. And the phrase that I used to capture what this process of the integration of culture would look like is the spirit of the drum, the heartbeat of the people. If as nurses, we interact with people with care and compassion, centered on our relational way of being and our relationships, in interactive, receptive, inquisitive, and reflective ways, we will come from a place that is respectful and one that honors culture. This is an important lesson and one that I take with me into the research that I've conducted. I also wrote a paper about the concept of colonialism as a determinant of health in the NWT. And it was published in the International Journal of Transcultural Nursing in 2004. We know that there has been a legacy of suffering and pain from the intergenerational impact of residential school that continues today, and the disproportionate burden of substance use and abuse, family violence, and suicide are expressions of the physical, emotional, and psychological toll on women and their families. Both of these concepts are important understandings and theoretical directions on historical influences on women's health and the care of women in the recognition of the importance of the context to women's health here in the territory. During my PhD work in the North Slave region, I took this photograph shortly after the arrival of this newborn, and you can feel the love and attention that a new baby brought to this family. This was one of many photographs used in an ethnography and photo voice study that I completed with Clicho pregnant women in around 2004-2005. Pregnant women and I both took pictures. We had hundreds of pictures, actually, and one repeated response to the question, what keeps me healthy, from women, was that my children keep me strong. There are many influences on pregnant women. Some historical barriers include the medicalization of birth, whereby every woman must travel for birth, and the introduction of formula to community women is another intervention. But what sustains women in our communities here in the North are their cultural, traditional beliefs and practices, and their interface and visits with elders. In this slide, I just wanted to bring to our attention that we do have high rates of type 2 diabetes in the territory. The Department of Health and Social Services reported in 2016 that 10% of the population over 24 years of age had diabetes. This Healthy Steps is a lifestyle prescription protocol that I helped develop as one of a team with Dr. Rob Petrella in 2012 at Western University. And we were lucky and fortunate to be in a pilot project with our students and faculty at North Slave campus. And this protocol supports people to change their lifestyle through a Healthy Steps prescription, an intervention of healthy eating and exercise whereby we were monitoring people's steps and what they were eating. And the results of this have been published in a larger clinical trial that took place in Ontario. And in there, they did find that there was an increase in physical activity, a decrease in sedentary time or sitting time that was sustained for up to 18 months after the participants were involved in the project. And the other important thing about Healthy Steps, as was mentioned in the introduction to me, is that we had student coaches who worked within the project with Betty Ann Marriott and myself, and they act as coaches for both faculty and other students. That is very empowering. Education is very empowering for women. The other thing that they learned about and that they completed was a photo voice of how people stayed healthy and what they did. And this is just one example, and that a participant took this picture and said this was from a little garden that she had just on her patio where she had living food in the north. And we know that our gardens across the north are very important. I wanted to include many visits to many different communities. And of course, this is a picture out of Looks Okay when I visited there. And I want to say that women and their communities are active participants in research today. And if they're not, we must always remember to include them. At all levels of the research process is what we're aiming for, so that women assist in identifying where the research is needed, developing the research questions, collecting and analyzing the data, and generating community knowledge and making changes to improve both their individual health and the health of the community. And these are very hopeful processes in enabling the strengths of women and their communities. We do know that women are very resourceful. Here are a group of very resourceful women who were actively engaged. This was launching of the Influences on Quality of Life report in the Legislative Assembly. And you know, across the North, we have many older adults engaged in their communities, and this combats social isolation that is experienced by some seniors. According to the World Health Organization, quality of life is an individual's perception of their position in life in the context of the culture and value systems in which they live, and in relation to their goals, expectations, standards, and concerns. It is a broad-ranging concept affected in a complex way by the person's physical health, psychological state, level of independence, their social relationships, their personal beliefs, and their relationship to salient features of their environment. You know, in this study, an older adult said, "We, in speaking of older adults, need to become a dog team so we can all bark, then people will listen to us." And another one said, "With a little bit of luck, everybody's going to be a senior someday." Just to review a few of the findings, there were both strengths and challenges to quality of life that participants in the NWT spoke about. They talked about the good life for older adults in our territory as being connected, socially connected and supporting each other, as being active and independent, as having feelings of safety and security, and traditional living and living off the land and knowing place and home were very important to older adults in the territory. The life struggles that they shared were a little outnumbered some of the good life, which is sad. They talked about pitiful times. These were times of colonialism, of residential school, of loss of cultural traditions, and for some elders, of elder abuse. They talked about the high cost of living. They talked about health concerns that they have, falls and injuries. Some elders talked about pollution of country foods. They're really concerned about alcohol and drug addiction, and are concerned about housing, overcrowding in housing, and poor housing conditions, and social isolation. There is a great deal to learn about care of infants and infant feeding from mothers and grandmothers in the territory. And this is a recent study that I know I will be writing and talking about for quite a few years to come. In this study, I was able to identify that although 82% of mothers began to breastfeed their babies in the NWT hospitals, exclusive breastfeeding, meaning 6 months or more, fluctuated from 17% to 60% across the territory. Both grandmothers and mothers shared their infant feeding experiences. Grandmothers mostly breastfed their babies, but some grandmothers did not. And this was related sometimes to being sick with tuberculosis, residential school experience, and loss of feeling private about breastfeeding. Breastfeeding became a private rather than a way of life of feeding their baby. The notion that modern women use bottles, not breast, also affected that. So the themes of the grandmother's stories that they brought forward in this study were being resourceful, surviving hardship, and rekindling the past and sharing wisdom. For example, mothers shared that there is a great deal of judgmental discourse around their feeding decisions and practices. As well, there is scrutiny to this day in feeding babies in the public. Some mothers want the fathers to be able to share in feeding, and for that reason, they introduce a bottle. Grandmothers share their support, and they say, we share our hearts with them and say, you're going to be okay. And they're there for them when they need that kind of support. From this study, the Baby Friendly Initiative was supported, and in our nursing curriculum, it is supported further and implemented and used to teach students. And this has really helped to be consistent with our knowledge and our practices to new moms. If anyone's on there from the Delta, and I know there is, this is a picture from the Delta, and grandmothers and elders have a unique and cherished role in our communities. They provide historical accounts of care of infants and children that preserve the culture, but they also offer support and understanding that is required by women becoming mothers. They recognize the importance of breastfeeding to both nurturing and nourishing an infant. There is, however, an influential history of colonization and the intergenerational impact of residential schooling that contributes to violence in the territory. And the causal conditions of intimate partner violence have grown out of this context, and they're revealed as trauma, unhealthy relationships, poorly resourced communities, and lack of safety and support. In response, violence continues to be normalized as a way of life. There continues to be shame and blame attached to violence that is most often directed at women who are the survivors of violence, not the perpetrators of the act. And IPV is exacerbated by the limited resources available to women and their families, and again by the social isolation women experience. It is complicated, and we know that it's influenced by many systemic issues and social determinants, such as unemployment, poverty, housing, lack of early life education, gender, health services, social exclusion, substance use, and even the ability to get safe transportation out of the abuser's territory. I put alongside here the map, which is an old GIS map that came from this project based on 2010 data. But in this map, when we used it, what became very apparent is that there was violence in every community here in the North. And that's a statistic that we really want to change. Ten years ago, we began a study of intimate partner violence, and one of the most significant barriers to women's health in the territory is IPV. It's defined as behavior across the lifespan from a person to a family member that is physically, sexually, psychologically, or spiritually abusive, threatening, coercive, uses surveillance, or in any other way controls and dominates the family member. There are a web of factors that contribute to violence, as I suggested before, but just to think about again, these social determinants: race, gender, housing, poverty, unemployment, colonialism that has led to a culture of violence and silence in many of our communities, alcohol use that fuels anger and aggression, depleted resources, limited services, and remoteness. But on top of all of that, there is hope on the horizon because we have extremely resilient women and families. And this web that informs IPV, we have identified in the larger study as a web of disheartenment with hope on the horizon. And this slide addresses the way that we move forward. And these were published, but I think we have acted on some of these actions to date. And some of the things that we're doing even here today, knowledge mobilization, talking about it, getting people to talk about it, people taking part in making change, and getting the information about how to get good help and developing good safety plans. So to do that, we need education and awareness, and we need to know that violence is not okay. It hurts everybody. We know that we need stable and adequate funding, and man, this is going to be tough in a pandemic where we are using so much funds. But we know that we need to really direct those funds to a coordinated response strategy so that women don't have to shop around for help, so that we have one place where women can get help. This is what we need to work towards. We need really good assessment and screening, and we need social supports, and above all, we need community healing. And I think there are big steps that have been taken in the territory with the Arctic Wellness Camp, and I know that there will be more healing camps over time. We've recognized the benefit in healing on the land. Sometimes we don't have community-based research, and then it is really important to report back to the community. This is a picture of us reporting to a small gathering in Tuktoyaktuk. We went to many communities, went to 12 communities to report on the IPV study, and this is really important. And all of those times we'd fly off in a little plane, and this day when we flew back on this plane, there were two moms with their babies leaving the community because of violence. That's a tough go, you know, when you're on the same flight of what you've been talking about. Tough for them, but also you realize hopeful for them as well, making a change. This slide is about a study that is just being completed now. It will be finished as of June. And it is the Canadian Domestic Homicide Prevention Initiative for vulnerable populations. And unfortunately, domestic homicide is a reality in the North. And as identified in this study, one death is one death too many. I think please visit the website if you are looking for more information, because there really isn't time to talk about all that the study has been trying to address, but they are a knowledge mobilization unit, and they're situated in Western University and the University in Guelph. And one of the calls of action from the Truth and Reconciliation Commission was the call to action 39. And it was, we call upon the federal government to develop a national plan to collect and publish data on the criminal victimization of Aboriginal people, including data related to homicide and family violence victimization. That is a big purpose of this study. And there are, they do maintain a domestic homicide database, and it is being actioned through this study. And there are domestic violence death review committees. We don't have one in our territory, and I think it's something that we should work on. These are multidisciplinary advisory committees of experts, and they review deaths, and they try to identify where could have we intervened to have prevented this tragedy so that hopefully we don't have more death. And statistics as well from the Canadian Femicide Observatory for Justice and Accountability has also identified that one woman or girl is killed every other day, on average, somewhere in our country. That is a high statistic. And these loved ones are missed by their families, and there is a huge impact on families. And we are not immune to this here in the NWT. In 2020, 2 young women were murdered in our territory. And already in 2021, another woman has been murdered. So these are reported in social media. Some stats, particularly the stats on the Femicide Observatory, are picked up that way. The purpose of the observatory is to bring awareness and to bring action to make this statistic turn around and not be here in Canada or in the territory. Oh. So I just want to mention some of the good things that are happening in the territory. The NWT Coalition Against Family Violence is a group that has been around for quite a while and has been resurrected again. This is an older photo. Activists need to work together, and one way they can do that is by sharing information and action with each other and with our communities so that we get good information out there. Another way that we have got information into the communities is through community affairs, and this information at the local level is really needed to affect positive change. And we have many communities have done advocacy events for violence against women. And I do know that many communities participate in these activities, things like Take Back the Night and the December Vigil. These are important things for women to do to bring awareness. Cultural safety is a concept that we have worked together to illuminate, a group of us, the meaning of being culturally safe in our educational environment. It was a writing exercise that we did trying to identify how we could be cultural, how we could create these safe environments. And I would like to extend this to our territorial places. Through that writing project, we realized that we were all able to find a culturally safe space. If we were, it would be through a relational process. And this is a process of caring relationally. And it's important, and we need to do it in our everyday encounters with women and their families. In 2020, we experienced lockdown and work from home. I had a little flood in my condo, and thank goodness, in the first several months of the lockdown, I was locked down with my family. But I do want to say that women's health during the pandemic has been identified as a gendered issue. The pandemic has increased workload for women, both at home and at work, with the lockdown and the quarantine measures. It has been reported in the literature that emergencies like the pandemic increase the oppression and the inequities that women experience. The Canadian Mental Health Association has reported that women have higher levels of anxiety and loneliness than men, and that 1 in 5 adult Canadians, 20.3%, reported seeking professional help for mental health concerns as a way of coping with the pandemic. In Canada, employment decreased by 16.9% for women compared to 14.6% for men. And that was reported by Chairman Boogie of the Society for Obstetricians and Gynecologists. In 2020, the Public Health Association reported that 57% of COVID-19 infections and 54% of deaths are among women. And the CDC in the United States gives us some good suggestions of what we should do as caregivers. So we need to maintain healthy behaviors. We need to take these steps to protect ourselves. We need to isolate when we're advised to do it. We need to wear masks. We need to do things like meditate. We need to eat healthy foods, and we want to exercise regularly. We need to get plenty of sleep. And we do know that the territory is known as a territory of heavy drinkers, and along came the pandemic. We need to avoid alcohol and substance use. We need to manage our stress. So we need to take breaks from listening or watching social media postings too long on COVID-19. It can become quite stressful. And if you notice that happening, you need to turn it off, walk away. We need to connect with others, and we need to talk with people that we trust if you have concerns during the pandemic. With that, I'm going to bring this talk to a close. I have no idea whether I'm over or under in time. And I just added this picture because what we need to do is enjoy our beautiful territory and the land we live on. I look forward to any questions you have now.
Thank you so much, Pertice.